thank you all for joining us today. We'll be talking about IMLS, DOE's data policy, and FDA's publications policy. And I also kind of want to set these policies in context with all of the other agency policies. So I'll do some kind of comparisons as well as we go through them. Um, so to start, I'm going to kind of focus on the data side of things and focus first on DOE's data management policy. Um, I do want to mention that a number of the policies I'll be talking about, that we'll be talking about today, do go into effect today. Of course, with the government shutdown, things are a little bit different, but these new policies are only in effect for new awards, the ones we're talking about today. And so when there are new notice of funding opportunities or new awards that go out kind of after the government comes back and is reopened, that's really when kind of implementation will start for these policies. So for the DOE data management policy, it will be in effect for awards that are awarded on or after October 1st. DOE's publication policy is already in effect. The data policy, the scope that I'll be talking about today is kind of focused on financial assistance awards. In terms of how DOE defines scientific data, it is consistent with other agencies and consistent with the language in the 2022 memo talking about digital recorded factual material, in particular that is used to validate research results. In terms of the expectations around data sharing, DOE does talk about the fact that underlying scientific data used to generate the peer-reviewed scholarly publications need to be made freely available and publicly accessible at the time of publication. There's also an expectation that any of the data that's made publicly available needs to be reported to DOE's Office of Scientific and Technical Information, or OSTI, which happens to be my old office. But the expectation there is not that that office will host the data. You can still kind of have flexibility on the data repository you use, but you need to kind of report that and provide a link to where the data is hosted. So that way it's kind of in a central discovery tool hosted by DOE. In terms of the expectations around sharing other data that don't necessarily directly support a publication, the policy says that you should talk about a timeline for sharing that in your data management and sharing plan, and that it should be kind of provided in a timely manner, I think is the exact wording. For data management and sharing plans, they are required for new activities, awards, and grants. This is consistent with the policy that has been in place, but some of the suggested elements and kind of expectations are slightly different. In terms of giving attribution, similar to the expectation for publications, the DOE does ask that or does require that you give attribution to the sponsoring organization in the data that's being made publicly available. And that there are some kind of compliance pieces to this. There is, if there is an expectation that you follow what you say you're going to do in your data management sharing plan. If something needs to change, you can talk to your program manager. There are ways to update your data management sharing plan, but if you don't update it and fail to kind of appropriately follow it, it can negatively influence future funding opportunities. I also wanted to mention kind of what they say around data preservation, and this is an area that they ask folks to talk about in their DMSP. And one thing that they ask folks to consider is kind of a balance between the relative value of long-term preservation and access with the cost and administrative burden that comes with that. And the thinking behind this is that some data is kind of easier to recreate than others. A lot of what DOE funds goes into massive facilities and equipment and things like that. And so that really needs to be kind of shared long term, but to consider that balance. So that was kind of a very brief overview of DOE's data management policy. I also want to provide a brief overview on IMLS's data management policy, which also will go into effect for new awards on or after October 1st. It's a similar kind of policy scope. Uh, in terms of talking about data underlying publications needing to be made publicly available, one thing that is different about IMLS's policy is it really only talks about data underlying publications. It is it is silent on kind of the other data that might be generated under the award. Their definition of scientific data is consistent with other agencies. Um, their data sharing expectations are that researchers must deposit permissible scientific research data underlying the publications into a chosen repository immediately following publication of that journal article. But researchers have the flexibility to choose the most appropriate repository for them. One thing that I found interesting is that IMLS's policy does not specifically talk about data management sharing plans or expectations around them. From talking to some folks that have had former IMLS funding, it seems like those expectations are included in the notice of funding opportunities. So I expect that that will continue, that for those applying for funding where data will be generated, there would be that expectation. It would, and the kind of requirements would be included in the NOFO. So wanted to kind of briefly compare the DOE and IMLS data management policies with other agencies. So I just kind of have a couple of slides here covering some high levels to kind of compare those. So first is the definition of scientific data. Luckily, this is fairly consistent across agencies. There might be slight word variances, but most of them kind of refer to the 2 CFR definition. And that talks about kind of digital recorded factual material used to validate research. This is also what was included in the memo. So I think maybe it's to be expected that it's somewhat consistent. There's also a fair amount of consistency about things that are excluded and would not be considered data under these policies, things like preliminary analysis, samples, physical objects, draft papers, future research. And then some agencies have added on to that. So for example, lab notebooks, peer review, case reports would not be considered data that would need to be made publicly available under these policies. All of the agency policies talk about requirements for sharing the data underlying peer-reviewed publications. There's some slight variance in when that would need to happen. A lot of the agencies say that the data needs to be available, on the publication date. FDA says as soon as practicable after that publication date, and EPA says within 30 days of the publication date. For sharing other data, I mentioned IMLS their policy doesn't talk about sharing other data that doesn't support publications, neither does FDA's policy. But all of the other agency policies so far do. So HRQ and NIH talk about making it accessible as soon as possible, but at least by the end of the award. NASA's Science Mission Directorate also talks about, making it available by the end of the award. CDC, Department of Education, DOE talk about making the other data available in a timely manner. And for Department of Education, it's at the completion of the final study or 5 years after the award is closed, whichever comes first. And then lastly, on the data management and sharing plans, this is pretty consistently required for new awards and grants. What I have seen in some of the previous IMLS NOFOs is that it's data management sharing plans are required for applications that involve data collection, as you might imagine. For data management and preservation costs, all the agencies do talk about this being an allowable cost and recommend including it in budget proposals for consideration. Most agencies talk about some kind of compliance, whether that's in future funding awards or the DMSP becomes a term of the award. And then there's no agencies that kind of always specify a specific data repository. I think there are certain solicitations, certain NOFOs in a specific area that might require a specific repository, but overall, agencies talk about using data repositories that meet the desirable characteristics or FAIR standards. And it's generally kind of applied across all of the policies to encourage the use of established repositories. So that was a very quick overview of kind of the data management side of things. I now want to kind of transition to looking at the publication side of things, starting with IMLS's publication policy, which is for new awards on or after October 1st. So this is only for new awards, it's not for existing awards. I wanted to make that clear because that's going to be important when we talk about the repository. But the expectation is for the submission of machine readable copies of the most appropriate version of the manuscript. So it could be the VOR version of record if that's allowable, otherwise the author accepted manuscript. And it needs to be submitted no later than the article publication date. And then there's an expectation that the repository that's hosting it will be making that available without embargo. Now, IMLS has not yet designated an agency repository and doesn't really speak on this in their policy. I think the idea is that since this is for new awards, no one's going to be publishing immediately from their new awards, and so they have a little bit of time to continue working on this. But I was able to connect with someone at IMLS, and they said that we should look for additional guidance early this fiscal year. So hopefully when the government opens back up, they can continue working on this, and we'll definitely be looking out for that guidance and can share it as soon as we learn about it. FDA's publication policy actually went into effect August 15th. We were able to cover FDA's data management side of things and our kind of overall data management webcast in late August. This timeline was news to us. They had actually already put out a policy saying that it would be effective in January of 2026, but when they were working on their gold standard science report, I guess this was kind of coupled with that. It is their public access policy is referenced in gold standard science, and I think they were following NIH's lead by upping the start date, and so they updated their policy to say that it was effective kind of immediately starting for awards on or after August 15th. And so the expectation there is to submit a machine readable version of scholarly publications that have been accepted for publication, including all of the changes during peer review. So kind of that now standard definition of author accepted manuscript, and that it needs to be submitted as soon as practicable after that formal publication date. And then there is the expectation that repositories will make the accepted manuscript immediately available without embargo. Now, FDA is also a little different because they do not specify a specific agency designated repository, and I don't think they plan to. The way that their policy is written is it gives folks flexibility, which is very unique and different than other agencies. One thing that they do say is if you have co-authored a FDA funded publication with FDA staff, then you do need to use PubMed Central. And all FDA funded authors can use PMC, but it is not a requirement. You could potentially use an institutional repository as long as it meets kind of their definition of what a repository needs to do, which is like enable public sharing and review of information at no cost, searching of metadata, and scholarly publications. And in their policy, they include kind of this definition. So as long as the repository meets that definition, you can submit there. And we did get a question about this ahead of time, so I did reach out to FDA to confirm, and they did confirm that that is the correct read of the policy. So comparing IMLS and FDA with other agencies, the scope is pretty standard: peer review scholarly publications funded by the agency. That submission timeline for when you need to submit the author accepted manuscript is slightly different between agencies. Um, the majority of the agencies say that you need to submit it upon acceptance. IMLS says no later than the article publication date. FDA is as soon as practicable after that publication date, and then EPA is within 30 days. So there are, like I mentioned, some slight variations there. And then there is this expectation that all of the accepted manuscripts be made immediately available within the repositories with no embargo on that publication date. In terms of compliance options, a number of agencies are expecting authors to submit the accepted manuscript themselves. There are a couple of agencies that do provide multiple options. So either the author can submit, or if that agency has agreements with, publishers or through Chorus, publishers could submit on behalf, like with NIH, but I think that's something that we are watching to see if publishers are still willing to submit on behalf of the authors. So just wanted to provide a quick overview of other agencies before I hand it over to Dave. Generally, we do still expect other agencies to have their policies effective by the end of this calendar year as required by the memo. I think some agencies may be using gold standard science as a way to kind of reframe their public access implementation. Most of the gold standard science plans that have come out have referenced the agency public access plans and policies. So I think that's a good sign to see that agencies still plan to move forward and it's still kind of a high priority. But there are a number of agencies that have not actually released their plans or policies yet. So that's something that we'll be following up on those agencies with. There are some agencies that have their policies posted publicly and do have effective dates. NEH's effective date is today. The reason I didn't cover it in this webinar is because I unfortunately have not been able to get in contact with anyone at NEH to confirm that the policy, is going into effect. So if anyone has talked to anyone at NEH or has contacts there, would very much welcome that. We'd love to get in touch with them. And then there's also a handful of agencies that say that they'll roll that out December 31st. So ACL, Administration for Community Living, Administration for Children and Families, Census, and then the Centers for Medicare and Medicaid Services. I know NSF is a big open question, and previously, I had been hearing that their Path G, which will be used to implement public access, might be coming out sometime in September. That obviously did not happen. And so this is something that we're watching for. I think what's happening is there's a lot of kind of new policies, not just public access. There's a lot of kind of implementation of different things. For example, I think National Security Presidential Memo 33, some expectations are going to be in the PAPG as well. And so they're trying to kind of get that all in there before they roll out the new PAPG. So that's something that we're watching very closely for, and we'll share as soon as we hear anything firm. NOAA, I know I keep saying this, I keep expecting this policy at any time. That's what I keep hearing. And my understanding though is that they're maybe waiting for the new administrator to be put in place. And I think that the NOAA administrator nominee is part of a package that they were hoping to push through the Senate. Obviously with the shutdown, there are other priorities right now, but hopefully that'll come back up soon. And then the administrator will have a chance to look at the policy. And our understanding is that once it's released, it will go into effect immediately. We were able to get in contact with DOD, particularly DTIC, the Defense Technical Information Center, which is like their library type organization. And unfortunately, at the end of August, they were significantly affected by consolidation and a RIF. And so their staff has been significantly cut, a lot of the folks working on public access. And so they said, with kind of everything else going on right now, they're not currently focused on public access. And so that's something that, we'll keep checking in with them to kind of see where things stand. So with that, I will hand it over to Dave.
Thanks. So I'm going to talk about just a little bit of how some of these public access policies are working in terms of licensing and permissions. For those of you who have been on earlier webinars about some of these, some of this is retreading old ground, but looking particularly at how, like, for instance, on this slide, how IMLS is approaching this issue of kind of actuating the federal purpose license, which for those of you who maybe haven't encountered this before, this is basically the legal mechanism that underlies the grant. It's been in grant agreements for a very long time, and it grants the federal government a royalty non-exclusive, irrevocable right to use the results of grant-funded research um, for federal purposes and to authorize others to do so. So the IMLS is one interesting because it explicitly recognizes that it's relying on the federal purpose license. Not all of the policies do that. That doesn't mean that they're not underlying it. The agencies have no obligation to like pinpoint exactly where that authority is coming from, although I think it's very helpful, particularly for consistency's sake. And so IMLS does that. Um, and they have a pretty straightforward assertion of it in their public access policy guidance. Um, One pretty interesting thing, though, about what IMLS has done that is a little different than some other agencies is they haven't put any. They've been pretty easy in terms of requirement to disclose the federal access policy, or sorry, the federal purpose license or government use license. So all that they do is they encourage recipients to communicate to the journal or publisher that the article is subject to the IMLS public access policy. And I think at this point, most probably virtually every publisher is aware that these public access policies are rolling out, and that they rely on a grant of a license to the federal government. Um, and so IMLS encourages, but it doesn't absolutely require you to put that in there. My advice to people is that it's a good idea to acknowledge that that license exists. Um, but it's also worth noting that they don't go any further than that. So I've heard questions from authors and researchers asking, for instance, does this mean I have to put a Creative Commons license on my work? And none of the agencies are requiring like a Creative Commons open licensing, and IMLS certainly is not. Um, uh, so that's kind of how IMLS is approaching this. And it seems actually pretty characteristic of the kind of approach that IMLS has said all along that it's going to take. I've been watching this one in particular because uh, how the smaller agencies with smaller research portfolios approach this, I thought would be pretty interesting because a lot of them aren't in the STEM heavy OA publication sphere where, there are kind of well-worn pathways to open access. Whereas at least for some IMLS funded works, there is probably a need to be a little more flexible, little more flexibility, and they've kind of, I think, reflected that in their policy, particularly around some of the licensing. Do you want to go to the next slide? Uh, FDA publication availability. Um, so the FDA is requiring that extramural researchers make the final manuscript and metadata available in full text as soon as is practicable after the publication date. And Carly, jump in on any of this if you'd like. Um, and they make very clear though that agreements with publishers that run contrary to any grant of rights under the federal purpose license in particular underlies this, but any grant of rights to publishers to the contrary does not serve as adequate grounds to avoid compliance with the public access requirement. And I'm glad that they're kind of upfront about that. That's an issue that I think in retrospect, I'd like to see more agencies kind of be very clear about. It's a question that a lot of people have is like, well, I signed something different, so whose kind of assertion wins here? Um, and if you stop and think about it for even just a little bit, I think the answer becomes obvious, but I think it's helpful for the federal agencies to kind of put that on blast and help people know that that's the case kind of going in. Um, uh, and the FDA generally requires funding instruments whose terms prevent an extramural researcher from entering into such an agreement with a publisher. Um, so that is FDA. Um, Now, I think we have, do you want to go to, thank you for moving to the next slide. DOE data licensing. So data licensing has also been an area of just a little bit of confusion, both in terms of data. I guess it's helpful to kind of split the data that we're talking about here a little bit and talk separately about data that is originating with the researcher, originating with the research project, original data, and the requirements for licensing that material under grant awards, and differentiate that from research projects that use third-party materials that may have separate rights associated with them. Um, so basically under DOE, for data licensing, when contractors or any award recipients assert copyright over that data, which I have like a, big red flag. Think about that for a moment, because to the extent that you are asserting copyright over that data, it's usually worth talking with someone who knows at least a little bit about copyright law to help you assess whether there is actually a copyright there to begin with. Copyright does not, of course, protect facts or ideas. And so oftentimes, I think there's a little bit of confusion about where to apply or how to think about copyright, where to apply licensing. So, for instance, I see a lot of kind of good-natured efforts to share data under a CC BY license when in fact the underlying data isn't protectable to begin with. And so that actually adds a restriction, or it seems to add a restriction to downstream users rather than relieving restrictions. So anyways, the point here is the DMSP should address licensing requirements and any limitations for sharing of that data. I think consistent with the general spirit of all of this, the idea here is like you should be trying to find a way to share this as openly as you can. Um, uh, and when there's an assertion about data protection, it won't be shared with the public during that data protection period. Um, and Carly, you can jump in here because you may know. I didn't see, and maybe I just have missed it, if there are like restrictions regarding the duration of the data protection period. Do you happen to know this offhand?
For DOE in particular, usually the protections are around SBIR and STTR, if there
Okay.
are any. There can be some limitations if there actually is a basis to assert copyright or things like that. So I think some of the DOE national labs, for example, might say they're going to try to commercialize for some period of time. I'm not sure if that's the same in universities, but then basically, if there isn't any commercialization, they kind of give that up after a certain period. But at least in terms of the policy, there's not kind of anything specific in the policy around that.
Okay, thanks. That's really helpful. And actually, that folds into the next set of slides pretty nicely because they're some kind of FAQ questions, one of which is directly on the point of like, well, what about other people's stuff or, commercialization? Um, So just at a high level, how should researchers think about data copyright and licensing in terms of compliance? For the most part, the agencies really don't say a whole lot about copyright in their policies or really specify requirements regarding data, that is, not the publications. Um, and so, I think you should think hard about whether you can or should copyright that data. In some cases, there may be some thin copyright around the compilation of otherwise unprotectable data. And so it may be possible to assert rights there. But one of the challenging things with data sets when you're like throwing copyright notices over them is it can really inhibit downstream reuse and collaboration. And so I think in this situation, it's very different than a copyright assertion over an article where there are real economic interests in selling and, potentially relicensing. And for the most part, we're not seeing data have that kind of market. And so, I think the fewer restrictions, not only is it kind of fit within the spirit of these policies, but I think it also just kind of greases the wheels of collaboration in a way that is very helpful and usually not particularly harmful. Um, but the underlying thing, though, is the data still needs to be made publicly available in compliance with agency requirements. So regardless of what you say about the copyright in it, if anything at all, it still has to comply. Um, but next slide, I think, addresses this. Um, of course, there are exceptions, right? How should we address data that can't be made available? Some of it's protected, some of it's owned by third parties. And I think this is a particularly interesting slice for agencies outside of STEM fields where we do have data sets that may include copyrighted materials within them. I mean, anybody who's worked with like an AI researcher knows this is a really big problem in that space where you're working with training data, for example, or refinement data or other things like that. But typically in these policies, there is something that deals with addressing these kinds of concerns. Often they're not specifically dealing with copyright. Several of the policies address IP rights as a kind of catch-all to flag that like it is you're not being forced to like violate someone else's intellectual property rights and disclose that out into the world. But they should be captured in the DSMP and reviewed during that process. I think that's a pretty important thing that it's not just like, oh, we just are assuming that all of this is protectable and we just can't do anything with it. So it's kind of a like excuse to not share data. That's the sense that I get anyways from both the policies and the folks at the agencies working on these. Um, Retroactivity. Yes, this is a good question. Does the federal purpose license apply retroactively to grants that were accepted before the new policy takes effect? Yes, but so the FPL has been in basically all research grants from the federal government since the 1970s. It's been this kind of pre-existing license that has just existed for a long time. Sometimes the government has elected to use it for certain reasons, and sometimes it has not. Sometimes it has done it in kind of very official ways, like through these public access policies. Um, and sometimes they've just kind of informally used it in other applications, including like very routine sort of pedestrian uses, like sharing copies of articles, interagency, uh, things like that. Um, but there are two things here that are important. One is even when an agency doesn't specifically name the federal purpose license in its public access policy, it still applies. It's still there in the background. It's still incorporated into the grant agreement. And so that legal mechanism still functions. But it's also, I think, important to acknowledge that just because the license is there doesn't mean that the agencies are also retroactively using it. What they're doing is they're putting in place these public access policies that apply at a certain period of time moving forward for material published under them. Um, just because the agencies have the right under the FPL to exercise it with pre-existing works doesn't mean that they're, aiming, and there's certainly no indication that they're kind of wanting to go and grab documents or articles from previous grants. Um, Are publishers changing their workflows related to this zero embargo policy? Yes, definitely. Some publishers have stopped automatically depositing, for example, to PubMed Central. Um, Increasingly, we're seeing this second bullet point. Publishers have added click-through questions on submission portals that ask about specific funding. Um, Another thing that I've started to see is, publishers have always asked for information about conflicts of interest and about funders, and they're starting to connect that data, I think, in a way that maybe they hadn't before in the publishing workflow, where, if you are acknowledging um, uh, NIH or IMLS or DOE or FDA funding for your research, don't be surprised if you get slotted into a workflow that says, okay, this is how you must proceed with us as a publisher. Um, so that's the experience that I've seen. I'd really love to hear from people who are either submitting articles themselves. I mean, I've kind of poked around and done this on a few platforms, but there are an awful lot of journals and an awful lot of publishers. So your experience would be really helpful to get a sense of other adaptations or changes that you're seeing from publishers in response to these. But that's basically the landscape of what I've seen so far.
So I think there's just a couple more FAQs, and then we can jump into hearing more from you all. But we did get asked about, if there are additional guidance from NIH or other agencies about allowable publishing costs. I think most of you are probably familiar with NIH's kind of announcements that they're looking at this and putting out an RFI that closed September 15th. And in that, which I should say SPARC submitted to, and I imagine a lot of you have as well. But in that RFI language, NIH did talk about having kind of a January 1st effective date for any new policies that they're coming up with. So I think, well, we're in a government shutdown, but otherwise I would hope that they're in the middle of kind of reading through those RFIs and kind of responses and using those to draft their policy. But hopefully we would see that kind of long before January 1st, but that's something that we are watching very closely. And, we have not heard any kind of additional guidance or anything similar from other agencies, following NIH's announcement. So other agency policies still ask that reasonable publication costs be included in budget proposals. There is still no government-wide definition of what reasonable means, but I think that's something that other agencies will continue to watch and track to see, how publisher fees, for example, have been changing over time. So we did get a question about if we can provide an update on IMLS. Are they still giving out grants? So I was able to connect with someone there, the acting director in the Office of Grants Management. And my understanding through that conversation was that some grants are being awarded, though I'm unsure kind of what is in that bucket, if they are new awards, continuation. But when we connected in September, I think they were frantically working to make the last awards of the fiscal year and trying to close out others. But would really, this is another area where it would be great to hear from you all, that the folks that I have heard from that, have applied for IMLS funding this last year, either haven't heard anything or, there was the expectation that there wasn't any new funding coming through. So I'm hoping to connect with folks at IMLS again in the new fiscal year once the government is back open and kind of check in on public access, try to learn more about the repository and maybe get more information here on this. And then, of course, there's this question of we're in a shutdown right now. How does that affect public access implementation? So I had already mentioned kind of for the new policies that are meant to go into effect today. Those would be for new awards, so that will kind of start implementation once there are new notice of funding opportunities and new awards going out. But for all policies that are currently in effect, those requirements are still effective. And I think there will be expectations to comply as long as folks are able. So sometimes government websites will go down in a shutdown. And so, if you're unable to submit to the agency designated repository, I think that's different. But my understanding is that the expectation would be to continue to work to comply with these policies as long as you're able to. And then the last question that we received ahead of time is around DMSP templates and whether DOE and IMLS are providing them. So DOE primarily has just provided suggested elements, which could be used as a template. I think there was one program office or sub-program office in energy efficiency and renewable energy that had kind of like a template, but generally just provided the suggested elements. And from what I've seen in some of the IMLS NOFOs, that's really kind of where the guidance is. But of course, there are lots of great tools that take these policies and kind of make them into templates. So DMP tool, for example, and I imagine those will be updated with the new policies as well.